Good afternoon, as always, everyone. Welcome to our weekly conversation. Many familiar faces and names here, and I'm sure more coming shortly. Really are honored to have guests with us from the WELL Institute, Rachel Hodgdon and Angela Spangler, and who they're going to speak to us just a little bit about WELL and the Institute. Many of you are familiar with LEAD, and Rachel came from the U.S. GBC prior to coming to the International Well Building Institute, was there for nearly a decade. And if you're familiar with the Center for Green Schools, she was founding director of the Center for Green Schools there at the U.S. Green Building Council, has led massive international efforts on resources for school districts, both in knowledge, which is a key point in helping to undergird the certifications and advice for guidance for folks around the world in LEED certification, and particularly involved with schools. And she's brought that passion and knowledge to the WELL Building Institute, and is working with Mary Filardo in the efforts nationally to help, as we're trying to do in our way, consider some of the guidance that we should take in K12 relative to our facilities, what we're learning from the pandemic, so that we can calibrate effective guidance and not neither overcorrect nor undercorrect. So really honored again to have Rachel here with us to lead the conversation. I'm going to turn it over as soon as I can stop talking and make my introductions. And Angela is the education sector lead at IWBI. And she comes with a focus in architecture and ergonomics and human relations, and she is going to be assisting the presentation today. Really grateful to have both of you with us. So as those of you who are joining, as we're getting started here, please type a little bit about your name and where you come from, what state, and what role with what district, and that can help Rachel and Angela in getting to know you and a little bit of the conversation. As always, as I get out of the way, please type your comments and questions in the chat as we go, and we will have time for discussion at the end. So, Rachel, Angela, welcome. Thank you.
Thank you, David. Thanks so much. Thank you for the invitation, and thanks to Mary as well for helping to facilitate this connection, and just for being the greatest guru on school facilities in the United States that I've ever known, and that is not an over-exaggeration. I think Mary has forgotten more today than I've amassed in the way of knowledge in my entire career. So a big thanks to Mary, just one of the truest K12 public servants that we've ever worked with. Like David said, we come from an organization called the International Well Building Institute. It's a public benefit corporation, and we've got a mission to transform the market by driving toward people first places. Oftentimes the shorthand for what we like to refer to as people first places are healthy buildings, but we are much more focused on the people than we are on healthy people than we are on healthy buildings. So we prefer that people first mentality. We're best known for something called WELL, the WELL certification. As David mentioned, WELL was a direct adaptation of LEED. It was inspired by the LEED green buildings rating system. But whereas LEED has a focus on planetary health, WELL has a focus on human health. And of course, there are a lot of intersections there. Daylighting both an energy conservation strategy and a health strategy, but there are also ways in which we diverge. For instance, LEED will look at water primarily through the lens of conservation, whereas IWBI and WELL look at water primarily through the lens of water quality, ranging from drinking water to other uses within spaces. WELL started like LEED as a certification for individual buildings, but today we offer a broader set of WELL pathways, certifications, ratings, scores that can be applied at the building scale, at the organization scale, and at the community scale, including across an entire school district. And as David mentioned, today I'm joined by my amazing colleague, Angela Spangler. Angela, as David said, is our education lead. So she works across K12 and higher education. And she's going to talk to you a little bit more about who we are and what we do, and how we approach WELL as a tool for market transformation across 10 themes, or what we call concepts, ranging from air quality to water quality to material health to movement, fitness, movement and fitness, nourishment, community connectivity, and mental health and well-being. We like to look at all of the different ways that our physical environment and our social environments can shape our health, well-being, and safety. You may be familiar with the concept of the social determinants of health, which is broadly accepted by the public health community. The social determinants basically say that where you sit and who you sit next to, or your physical and your social environment, has a greater impact on your state of health and well-being than your access to healthcare, your genetics, and your lifestyle and behaviors combined. And that's why it's so critically important for us to be focusing on spaces as a vehicle for enhancing outcomes related to everything from health to productivity and performance. Angela today is going to focus primarily on our newest offering, which is called the WELL Health Safety Rating. She'll talk about what it is and how it works, why we created it, and how it can function as an evidence-based roadmap for your state or for your district. We're also going to introduce you to some of the other things that we've been doing to support schools that we think might be immediately helpful for you, including our free COVID-19 teacher training. You can send this training or the link to the training to any teacher that you like, but we can also set it up for you if you're interested in administering it at a district scale. We can give you enterprise access so that you can white label it, see who's completed the training, et cetera. We did this as a public service in the midst of the pandemic because we felt that across the country, not all teachers were getting the information and the explanations that they needed to really understand within their own control what they could do, or within their own influence what they could do to protect themselves and those around them. And we know that depending on where they live, what kinds of news sources they consult, who their community is, that the information that they get could be anywhere from uneven to downright untrue. And so I think that we were hoping that this training could function as a kind of leveling of the playing field for explaining the science behind why some of these new interventions are coming into schools in the classroom, and really honing in on that which is within a teacher's control. So we'll tell you exactly where you can go to access that at an individual level. You can go in and sample it yourself. And at the end of the presentation, we're going to put up Angela's direct email address so that if you're interested in any of what we talk about today, you can contact her directly. The health safety rating that Angela is going to focus on was a rating that was really born of the moment. We heard a tremendous calling from our community and from our customers who are asking for a product that could specifically address acute health threats in the built environment, COVID-19 in particular, and focus specifically on operations and management improvements. Like, nobody was in the middle of this pandemic, especially as we were creating this rating, thinking about ripping out their HVAC systems and starting all over again. So it's like, what can I do with what I have? And that's really what we honed in on with the health safety rating. Now, I think that there are a couple of things that we've learned that we can take away from this pandemic. And one of those is that our buildings really are our first line of defense in the fight against COVID-19, but also every day in in terms of a host of other things that ail us, ranging from the cold to the seasonal flu, but also mental health and well-being, for instance. Buildings can either help or they can hurt. They, in and of themselves, can function like frontline workers for reducing the risk of transmission and slowing the spread. In particular, we've learned what an outsized role air quality plays and how critically important air quality management is. I'm thrilled that we're finally starting to have a conversation about the difference between face coverings and PPE. I'm thrilled that we're finally starting to be much more vocal about the fact that wearing masks really matters, but wearing quality masks is even more important. And so I think that's it's another thing for us to think about as we start bringing kids and teachers back to school, and thinking about where some of the potential federal funding can be best applied. And then finally, I think in terms of just what the science has really taught us, that not even just the science, the actual learnings that we've had working at organizational scale is that there's probably nothing that's more important that a school or a business or any other type of organization can do than having a policy and a culture in place that encourages people to stay home when they're sick. And I like to point this one out because I think it's easy for us to get focused on like, what's the stuff we need to do to the building, or what kinds of things do we need to be wearing on our faces? But truly, the most important shift that an organization can make right now to prevent the flow of the spread is to reduce the stigma and reduce any additional barriers that exist to having people stay home when they're not feeling well. At our office, the season that immediately preceded the pandemic, we had more than a third of our staff from our headquarters that were out with the flu. And that was mostly because we were passing it back and forth in the office. And so we know coming out of this situation that we're going to work really hard to try to encourage people to stay home when they're not feeling well. I know that there are a lot of barriers to that in school systems, ranging from the expense to substitute teacher availability. But I can't stress enough that if there's one thing that we take away and try and drive above and beyond the building, this is probably the most important lesson. And then finally, in terms of just meta lessons from COVID-19, and then I'm going to turn it over to Angela to get into the meat of it. This pandemic has taught us that the people who have the least suffer the most. We've learned that through almost every public health crisis that we, as a country or as a global community, have faced. This has absolutely exposed the depth of inequities that exist, not just in education, but in so many of our systems in society. And it also presents us with an unprecedented moment to start to really solve in a deeper and more lasting way for some of those systemic inequities, particularly in the case of schools as it relates to the federal government's involvement and engagement and responsibility when it comes to school facilities, from providing data on the state of school facilities and the needs that they have, to best practices for facilities management, to financial support and funding. We always marvel that there's not a single person in the federal government, across the entire federal government, whose sole responsibility is to focus on school facilities, which are such a massive piece of our infrastructure. We think that the pandemic may create an opportunity for us to really make some headway here. And I know that folks like David and Mary, and I'm sure many of you have had the direct ear of the new administration and members of Congress. We think there's really finally going to be some substantial funding coming through from the federal government to support the needs that you have on the ground. And while it's only going to be a drop in the bucket in terms of the billions and billions of dollars of need that school districts collectively have, I think maybe what we could say that what's even more important is the precedent that it sets at the federal government level for what the responsibility is, because we know at the end of the day, states and districts just can't do it alone. So that's why we're so excited to be reunited with Mary, who I've worked with for, I think, about a decade. Such a bright young thing when Mary and I started, and she was teaching me so much of what she knew. We worked together to co-publish the first the only two to date State of Our Schools reports that I know many of you have utilized in your own bids to amass more funding and support for your own facilities. And we're working on a number of projects to really bring these issues to light and revive a lot of those conversations, refresh a lot of that data. So you'll be hearing from us some more. Really pleased to be able to apply a greater focus of IWBI's time and efforts to the topic of schools. So thank you again for joining us, and thanks for the invitation. And I am going to turn it over to Angela, and she is going to give you all the relevant details. So Angela, over to you.
Thank you, Rachel. So it's really nice to have the chance to join in this session and present to you some of the work that I've been most passionate about for my entire career. As David mentioned, I started my profession in the field of ergonomics, first in healthcare and then in the corporate office setting. And what kept happening to me was I would be looped into these conversations when people were moving up their ranks and getting higher and higher positions and getting their own private offices. And they'd tell me, like, my back's been hurting my whole life, or I've been dealing with wrist issues forever, or I've never felt good at my workplace. And I realized that in practice, so much of what I was doing was really reactive. And it kind of drove me crazy, quite frankly, and really motivated me to continue to focus on how to create environments that prioritize human health and well-being from the onset. So people first places, right? When I was in undergrad, I was studying psychology and architecture and doing research in a biology lab, and everybody looked at me like I was totally bizarre for thinking that there was a link between these three things. But truly, that's what the Well Building Standard really stands for. And prior to COVID-19, we were really making the case for treating people and looking at health impacts from a preventative standpoint, not reacting after the problem already exists. So how can we build the link between how spaces influence your health and well-being for chronic diseases, for infectious diseases now? In response to COVID-19, we've done a number of sweeps of the existing research and evidence base that make up the Well Building Standard to further bolster it and strengthen it. So I've been participating sometimes quietly in these calls for the better part of the last year, and I've really loved digging into the science behind transmission rates and understanding the models that schools are looking to decide when to come back. And now I'm excited today to talk to you about specific research-based interventions that have the focus on human health and well-being in all of the spaces. This is a mission that we've had at IWBI ever since we were introduced into the market. So when I talk about kind of the evidence base that underpins the Well Building Standard, I thought it might be helpful to give you a little sense of how we're really evaluating our performance. So WELL is a holistic framework that pulls from best practice research, from industry research, from the emerging fields, emerging best practices within public health research, and also pulls together applied research from lab settings, looking at each and every one of these strategies or interventions in isolation and understanding how a holistic approach to better environments actually can influence things like human productivity, building performance, and ultimately the financial bottom line from an organization's perspective. When you translate this into the school setting, we're talking about how direct improvements to air quality can influence people's ability to learn. The study from Harvard, the COG effect study that we often reference, literally talks about as CO2 levels rise in spaces, our ability to do simple arithmetic is kind of out the window. So we're constantly looking at these different fields of research and these different pools of evidence to create a living, breathing standard that's kind of always adaptive and always responding to the moment that we're in. We've been in the market since 2014, and at that point in time, we were primarily focused on corporate office settings. We have evolved over time. We've introduced Well for Schools pilots back in the Well version 1 days, Well for all various different space types. With the introduction of Well v2 in 2018, we started looking at reframing the language in the standard to be more universally applicable. And then that sparked ideas in 2019 to come up with a way that entire organizations or entire school districts could look at this feature set or look at this evidence base, this encyclopedia of best practices, and start to systematically work their way through improvements that make sense based on their real estate portfolio. So that was introduced as the Well Portfolio Program. Last year was monumental for all sorts of reasons, but from our organization's perspective, it really highlighted two key things, in my opinion. One is that as the leading certification for healthy buildings, we wanted to do a review of the standards that we had put forward and identify any gaps or see where we might be able to further bolster and strengthen our message about why healthy buildings are important. And then two, it really turns the rest of the world on to understanding that significance and that importance of the healthy building movement. So, I've referred to this as like a silver lining moment where I'm no longer citing research and evidence behind these interventions in isolation, but I'm talking about how this whole entire framework or this whole entire system can really drive healthier behaviors and create kind of a baseline, level the playing field, or establish a culture of health across entire organizations. So we introduced the health safety rating. I'm really excited to dive into that in detail. But for those who are unfamiliar with the well building standard, the well building standard has strategies that fall into these kind of three buckets that are outlined right here. They're either related to the building's design, so how you can use things like nudge architecture to get people to move better throughout the space or make that healthiest choice the default choice. It's also based on the building's operations. So what types of cleaning products are you using? Anything from that facilities maintenance and operations category that can guarantee or can influence better behavior. And then on the other side of the coin, after we've established everything that the building can do to support human health, the policy related features come in and start talking about how having mental health benefits and having paid time off and having all of these policies that are going to garner better human behavior can really work in conjunction with better building design and healthier building operations. And so the WELL certification is kind of the ultimate goal, I would say, in truly denoting when a building is safe, healthy, has gone through the rigor of pursuing certification, having on-site performance verification, really detailing how they're holistically addressing not only physical health, but mental health and social well-being. But the introduction of the health safety rating, which happened, I think it was late June of 2020, takes that large encyclopedia of strategies and really boils it down to the 22 recommended approaches that we think are the most timely and the most relevant given the moment that we're in right now. And then in relation to our other kind of offerings, organizations can start with the health safety rating and then decide whether or not they want to move directly into a certification or move directly into a portfolio program where they're more systematically working through those features. Rachel had mentioned some of the different categories, we call them concepts within WELL, of strategies or features within the WELL ecosystem that make up the WELL building standard. And so one of the things that I think is relevant to point out when we're looking at all of these concepts together is that when you design a building to the WELL building standard, you're really not just following a checklist, you're actually verifying the performance of the space. So we have third parties who come on site to test things like air quality and water quality and the light levels and the acoustics and the temperature of the space, because within the standard itself, we're setting the threshold. This is how clean the air must be for healthier environments. Light needs to better attune to your circadian rhythm. And whether you do that through updating lighting fixtures within classrooms or within buildings, or you just provide more access to natural daylight, these are the recommended strategies to get people healthier, enable them to sleep better at night, enable them to achieve higher levels of focus and productivity throughout the day. The other 5 concept areas that aren't performance verified on site talk to things like the healthy food programs that you offer. So providing transparency, providing access to fruits and vegetables, just designing cafeteria display and meal plans and menus to get people to make better choices when it comes to how they're fueling their bodies. the movement concept really focuses on any opportunities to get people up and more active throughout the day. So things like activating different stairwells. One of my favorite memories back from when we used to work in the office and we would do kind of community service and community engagement was we were able to have members of IWBI go to local school district in New York City and actually start doing murals within the staircases that all of the students kind of contributed different paintings to, just to get kids more excited about taking the stairs, right? These are old buildings in New York City. They really have no alternative, but just to make things more, to liven up these spaces and get people feeling better about utilizing them. That was one of my favorite volunteer days off in my IWBI career. So moving on from this, I don't want to get too in the weeds with the features. All of the features, all of the citation, all of this is available for free online. I would encourage everybody to check out the website wellcertified.com and explore the standard and explore these features in greater detail. And if you are interested in really understanding in like a very layman's term general way, the evidence base behind each of these features, we recently published a series of research digests for all 10 of the concept areas. You can only see 4 on the screen right here. But this talks about all of the reasons why these strategies are important. So if you're trying to make an improvement, even if it's only in one category at your school and you need that justification as to why this is important, these are also free tools that I would encourage you all to download and check out, and certainly ask me any questions along the way. Now, before COVID hit, and today, one of the ways that we can track the momentum in this healthy building certification or this healthy building movement is looking at the number of projects, the number of countries, the number of registered square feet around the world. As of March 2020, we started seeing a dramatic uptick in the number of organizations that were interested in pursuing certification or engaging at a portfolio scale. From Fortune 500, just as one category, we've seen engagement across 15 to 20% of all Fortune 500 organizations. And we've seen about 1 million square feet a day enroll in this program and start to expand dramatically the reach of the standard, the countries that we're in. And this is really an exciting metric for us at IWBI because we can take learnings from all around the world, from school systems on the other side of the world. From the higher ed examples, the National University of Singapore has been really engaged with the WELL portfolio program and the WELL certification efforts. And we can take those learnings and continue to improve upon the WELL building standard and make sure that we truly have a globally relevant and globally applicable framework. Since we introduced the WELL health safety rating, there's been an even more dramatic increase in people just getting started with that program. That program was born out of the task force that we stood up on COVID-19 and other infectious disease that pulled together almost 600 professionals all over the world, public health professionals, virologists, architects, academics, leading researchers, everyone who had something to contribute around how important buildings truly are in this fight and how to better leverage them to keep us safe, was pulled into this task force. And the task force kind of did 2 things. It created a strategies document, which I'm linking the cover page to here, that talks about the WELL building standard, WELL version 2, and it identifies these 8 key themes that specifically look at prevention and preparedness, resilience, and recovery. So in the standard, you had previously seen those kind of 10 different concept areas. This exercise from the task force helped us go back and kind of take that fine-tooth comb across WELL version 2 before graduating it into its full standard to say, The feature that we used to have on hand washing was truly about the design of the sink and the dimensions of the where the water column comes down, and the soap and the hand dryer, and all of these really technical design-based recommendations to improve physical health. But one of the components that was missing until the pandemic was that education component about how important it is to have signage about how to properly wash your hands and when and why to properly wash your hands. So we essentially did that sweep of the standard and pulled together all of these existing strategies around improving air quality and maintaining water quality, the importance of doing water flushes to not walk back into a building that was a breeding ground for Legionella. We pulled out those features that really address things like mental health support and resilience and recovery. And we packaged that for any of the projects that wanted to move forward and pursue certification in response to this pandemic. These are the features that will be most relevant and most impactful. The second thing that came out of that task force was this health safety rating. We needed an easier start button, something that was truly more targeted and direct in responding to infectious disease, acute health issues, and really addressing, as our understanding of how COVID was transmitted, how to specifically tackle that approach and keep people safe. So this was developed to really address the challenges faced by COVID. We've seen incredible adoption. I think there's been probably about 100 million square feet of buildings all over the world enrolling in this program month after month. So we're continuing to learn and gain best practices as we evolve the future requirements and continue to learn about COVID as it adapts to create a stronger program to build confidence. Some of the earliest adopters of the program that you can see on the screen here, these are also kind of referenced on our website. I'll get into a little bit more detail later, but Fairfax County Public Schools has been one of the earliest to enroll their entire school district. And I've certainly learned a ton as they've gone through the criteria and recognized that a lot of the guidance that you're seeing in the health safety rating was previously put forward by groups like the CDC and the WHO and the ASHRAE Epidemic Task Force and our advisories and our standard setting group within our own organization. We've got 13, I believe, researchers who are masters in their own right, who are literally responsible for just understanding how each of these concept areas evolve and tracking how COVID is evolving and how to best address that in the rating. So I'm going to pause on this screen for a while here so that you can see from a high level perspective the types of strategies that exist within the health safety rating. There are 22 strategies in total. In order for an organization to achieve the health safety rating, they need to document compliance with 15 of these 22 features. It can be any 15, they're all technically considered optional. But we're looking at kind of the three main modes of transmission. So early days when we were all being told to sanitize our groceries and sanitize every surface and hand sanitize and wash your hands, and thinking that there was surface-borne transmission that influenced a lot of the cleaning and sanitization procedures, which are still relevant today, even though we know that COVID-19 is primarily airborne. That influences those features within the air and water quality management concept. But there was also that third piece, right? Buildings are only as safe as the people who are inside them are acting or are motivated to stay away when they're sick, for example. So those types of strategies exist within that health services resources category. In the cleaning and sanitization procedures, the feature about supporting hand washing is truly looking at do you have fragrance-free liquid hand soap available? Because we know that soap is just as effective as killing COVID and keeping people safe. Do you have hand dryers or paper towels? Do you have signage about how people should be washing their hands? How are you introducing measures to improve cleaning practices or specify better cleaning products, right? We don't need to douse every single surface in bleach. We need to be smart about the products that we're bringing into the facility so that we're not creating a different air quality issue by bringing in a lot of toxic chemicals that might off-gas or have a negative health impact from people coming into contact with them. The emergency preparedness programs, I think some of these features are critically important and some of the most relevant. They're likely things that you're already doing, but it's addressing an emergency preparedness plan that not only responds to a medical type of an emergency, but also looks at natural disasters, civic unrest, any type of an emergency situation, and understanding how the facility is going to operate. Is it going to shut down? Are you going to, like, what are the parameters that exactly need to take place in order to keep people safe? Business continuity plan kind of addresses that moment when everything stops and people transition to remote, not really understanding how long this was going to go on, and so on. So there, hopefully what you can see just based on these kind of feature names is that many of these recommended strategies organizations are already implementing. The value in the health safety rating is going through that third-party documentation review to say, we looked at all of this guidance, we implemented this guidance, here's how we're documenting our compliance, and helping to bridge that confidence gap about, we know you're doing the right thing because a third party helped to verify that, and it wasn't necessarily we're doing the right thing because we said so, or because, you know, the CDC said so, or the WHO said so. So I'm going to show you, when you are on the website, if you want to kind of explore the actual specifics behind each of these criteria and understand the evidence base, again, that makes each of these features relevant. You can navigate there from our main website, wellcertified.com, and just click on the health safety rating button, and it will take you to this, this type of a page where you can really start to do what I call like a gap analysis and understand from the practices that you've implemented where you might stack up against a rating system like this. Now I'm going to pivot and tell a couple of examples and a couple of stories of different school districts that I've been working with that have given me permission to speak about them publicly. So for WELL certification, the very first project to ever achieve certification in the education category or in the education sector was a preschool based in Santa Monica. It's called Untitled #1, and they achieved WELL Gold certification. It was truly remarkable as we're tracking, you know, what was it, maybe 35 projects in 10 countries around the world, to see that that first one that really made it over the hurdle of getting fully certified was a preschool. It helps to build a lot of confidence in the higher ed space. One of the very first portfolio participants to sign on post-COVID and decide to use the WELL feature set to make continuous improvements over time was the ORRVILLE School District. And that's based in Ohio. It's a fairly rural school district that shares a superintendent across the ORRVILLE, the Southeast Local, and the Rittman school districts. And they're looking at pursuing the health safety as their first step within their portfolio journey to create better environments where people are feeling more confident about coming back. There are way too many schools to name who are pursuing the health safety rating at this point. So I've listed a couple on the slide here. Fairfax, as I mentioned previously, was one of the first entire districts to enroll in this program. And when speaking with them, I've gotten to know various people across their organization, mainly in the facilities department, but also across the superintendents and, you know, all sorts of different folks. But Jeff Plattenberg, who's the assistant superintendent, said that the motivation behind doing the health safety rating for them was to prioritize the safety and the well-being of not only their students, but their staff, and ensuring that their buildings were optimized to provide healthy learning and work environment, which was a critical part of their effort. The Upper St. Clair School District was actually the first school district to achieve the health safety rating. If you follow me on LinkedIn, you probably already saw that I posted their press release, but their superintendent was also really focused on the health and well-being aspects for students and staff, saying that this is always going to remain a top priority as they come back and schools get back to in-person learning. And his quote from the press release that I liked the most was that the WELL Health Safety Seal is a further testament that we are sincere in our efforts to go above and beyond to provide the safest environment possible for teaching and learning. On that note, I'll say one of my favorite things about WELL in general is that in my past life, I was essentially a living, breathing benefit to the employees within the organization that I was supporting, right? From a workplace wellness perspective, functioning as an ergonomist. And my most productive year, I wound up helping 12% of the people in the regions that I was supporting, which meant almost 90% of the people either had no idea that ergonomics was a service that their organization offered, or had no clue that they could request better environments or basically utilize that service. One of the things that remains true about WELL and remains true about the health safety rating is that when you're making these types of enhancements that are just putting everyone first, you no longer have to make that opt-in choice, right? You're just giving better air quality or providing better access to light or getting people more physically active or supplying better food. It just helps to kind of collectively raise that bar, and you get 100% participation in a wellness type program or a wellness effort. I've mentioned the ORRVILLE School District. They were the first K-12 portfolio to really get involved. And theirs is a unique story about a local donor in their community who historically had provided funding for things like the football field, decided that he could truly make a better impact if he started prioritizing just health-related interventions. So the quote on this slide was from that donor. They've been in the community for 40 years, and they know that the kids in the halls of those schools are truly the future of that city of ORRVILLE. And it makes it an easy decision to know investing in children's health can only lead to better outcomes from the community. So those are some of my favorite stories and some of my favorite passion projects to work on while at work. We've had a whole host of wonderful conversations in the form of webcasts with Dr. Joseph Allen from Harvard, who's been all over the media talking about the importance of getting students back in school and the importance of doing so safely. We had a conversation what feels like recently, but I guess both of these in November were probably 4 months ago at this point. But a conversation between Rachel and Randy Weingarten, and then also addressing specific learning outcomes and learning needs, responding to the COVID-19 pandemic with Kay Sargent, who talks a lot about neurodiversity issues in the workplace and in the school. And an educator who's close to our organization, Denise DeCoste. So those webcasts and all of those conversations and resources are also available. I would encourage you to check them out if you're interested in learning more. We also mentioned the COVID-19 teacher training. This is free, available. It really looks at pretty much regardless of what teachers are dealing with from a facilities level perspective, all of the types of interventions are within the control of that educator in creating healthier environments in their classrooms. So it pulled from all of the best positions that were made publicly available from places like Harvard, from Joe Allen's work, from the CDC and the WHO, and various other resources who are talking about how to reopen schools safely. So I'd encourage you to check that out or share it with teachers in need, or get in touch with me if you want to look at making that available at an enterprise scale. And I'll just leave this contact information up. I've noticed chats coming through, so maybe I'll open up that chat.
Yeah, Rachel's been busy. As you've
Rachel's been busy. I know. I'm like
tackling as many as I can as we've been going along.
Thank you. Are there any that we should address?
Yeah, I mean, maybe if we'll just encourage people to take themselves off mute and ask anything they've got on their minds, or share any comments that you've got with us as well. Welcome it all.
I know many of you, so I know some of you are just waiting for somebody else to talk, but who's going to be first?
So David, can you hear me?
Yeah, we can hear.
Hi, Mary.
Hi, folks. Thanks for this. This is really great. I did want to encourage people to look at the teacher training piece. I know we had seen it early on, and it's just a really straightforward, but I thought extremely useful piece that as so many schools that had been just virtual are starting to reopen, giving the teachers an opportunity to sort of do a quick review on, practices in the classroom in a COVID environment. I think they probably appreciate it. Parents should see it as well, kind of knowing what to expect for their kids and, high school students and others. I think there's really a broad audience for it if it's out there, if it can be gotten out there. So I just want to make sure that folks don't miss that.
Thank you, Mary. Yeah, Angela will share the direct link in the chat. And like I said, when I opened, we're more than happy to work with you if you're interested in distributing it at the district scale to staff. I think in addition to teachers, it would be helpful for other professionals that are working inside of the school as well. I believe we've had it translated into Spanish. So we can set you up with like a skinned version where you've got your logo attached to it and where you can have access to the back end as well, so that you can do things like monitor completion rates. I'll say a few more other quick things about the training. It does not overstep. It's not about teaching a teacher how to be a facilities manager. So you don't have to worry about us trying to tell them things that are really going to sit outside of a teacher's control. And then also we had a cadre of lawyers that were reviewing the content on this. And in fact, one caveat that I do have about the training is that it's lighter on information about mask wearing than I would have liked, because at the time in order to make it a compliance ready training from a legal perspective, it had to align with CDC guidelines. And at the time, the CDC guidelines were really light on things related to masks and air quality. So we were like dancing around what the CDC was saying, trying to be accurate, but also, trying to be accurate in terms of the science, but also trying not to stray so far from the CDC guidelines that would render that training ineffective, because a school district is only going to take it if it actually maps to the guidelines that they're being held to. So yeah, do take a look. You can access it at the link that Angela put into the chat, and then get in touch with us if you've got an interest in distributing it at a district scale. And like I said, it's free to all of you. It was really just a public service. We saw a need and we just didn't see that it was being filled. And we know in this moment that buildings are only as safe as the people are interacting inside of it with one another and with the buildings themselves. And that was really what this was about. Chris,
Yeah.
David, Michael, being on camera, does that mean you have a question or something you want to share?
I don't want to hog the airspace, so anybody wants to unmute, feel free. I know there's some of you probably itching, so. Bob, Jerry, I could start picking on you guys.
I think this is very comprehensive. I'm not familiar with it, so I really appreciate being introduced, and I'll go take a look at it. Thank you.
Yeah, you're welcome. I want to also, I mentioned in the chat related to a question that came across the transom on acoustics, that we have an in-house acoustician. We also have an in-house air quality and thermal comfort expert, an in-house lighting expert, and on across all of our concepts. We've got dedicated in-house masters and PhD level researchers and advisors. So if you've got really specific technical questions that are coming up, I feel relieved that I think I've been able to answer all of them well enough in the chat, but we're really here for you if you run up against something and you just can't find the answer related to COVID-19 or anything really related to environmental health and conditions within buildings. So feel free to get in touch with us as those things emerge. Though that group of, I think it's about 13 people, including our new chief medical officer, they're constantly scanning the literature, and our standards get upgraded according to shifts in what that literature and what the research has to say. So the standards should always be up to date in terms of what we know. And the team is really good about monitoring everything that's coming through on the airwaves and everything new that we're learning about this virus and how it's evolving.
So Rachel, I think one of the conundrums, I know several of the folks on this call and many of the others we've talked with are in the midst of some very heated work, and conversation might be too polite about reopening at this point. And there has been a very unfortunate and we think unnecessary us versus them setup for reopening. And to opine for minutes, that's probably largely because the guidance has been so vapid and shifting, and often, as we discussed previously, not scientifically based or even bent sometimes in it. And so now, like in the moment, like what, and not asking you to put on your hat as one of those cadre of lawyers you mentioned, but what kind of advice would you give the folks who are on this call who are trying their darndest to work with administration, to work with teachers, to reopen, because that's coming, to instill confidence in all sides that this is, and not get away from this us versus them kind of.
Yeah, I mean, gosh, it's an impossible situation. So my heart goes out to everyone who's contending with these scenarios right now. And there are really no winners, only losers. And mostly the losers are the kids and the teachers and the staff who are suffering through all of this, and the facilities folks who are suffering through all of this as well. It's just such a travesty for the education sector in particular. And as the daughter of 3 generations of educators, this is one of the greatest challenges that I think we've ever faced. I mean, I think first of all, like, you have to rely on the science, right? That's the only foundation that we should be having for a conversation. And while I know that that's particularly difficult in some areas, insisting on returning to that science is critically important. And oftentimes bringing in third parties or third-party resources to advise on that can be helpful as that third party, not to say this is what you should or shouldn't do, but to say this is what the research tells us is most important. I think that this is the reason why we see more and more school districts and other sectors as well opting to go through the actual verification process for the health safety rating, because it functions as a kind of shorthand for addressing that confidence gap. Like, what is the delta between between perception and reality, and does it even matter in a moment like this? It is still, as much as I'm saying go to the science, it's still an emotional conversation. It's still a complicated conversation that like isn't always based on science. For instance, like the over cleaning that we're doing, like I just saw this like announcement, like these schools, like an entire school district is closed for deep cleaning. There's not a single case of COVID that's been that's been tracked to like contact with a contaminated surface. And so it's, in my mind, it's not a particularly good reason for shutting down school and preventing kids from showing up. And yet I'm not saying it's the wrong choice, because there is a perception moment. My alma mater, Tufts, made one of the dorms available for overflow for hospitals, and they had parents calling up and saying like, you better burn that mattress, like you better replace all the furniture. And it's like, okay, all right, there's not going to be any COVID on that furniture by the time you get back. Right. But it kind of goes to show like you still got to address those fears, and fear is what's driving so much of this. And so things like seals on the door, like the health safety rating, they help to bridge that confidence gap, and they function as like a kind of shorthand too. It says like, look, we've followed the best practices, we're having our work checked by a third party, and you can have a sense of confidence that we're doing the best that we can to keep your health and safety in mind. Now, would we ever say that a building that achieved a health safety rating is a building that won't transmit COVID? No, that's an impossibility. Sure. But when it comes to doing the best that you can, I think it's helpful to be able to rely on third parties like that. I saw that David submitted a question about how well building standards can be applied to older buildings that are not undergoing renovations or upgrades. This is a place where we're pretty proud of the work that we've done. First of all, on the well health safety rating, there's nothing in there that requires major capital improvements. So for instance, in sections where we address air quality, we'll say things like, go in and figure out what the maximum ventilation rate is, whether you're using the highest level of filtration that your system can handle, and things like that. But we're not going to suggest like that your system has to achieve certain thresholds. Those features do exist in the well building standard, but other than a handful of what we call preconditions or requirements for what every building must do, it's a flexible scorecard. That's one of the ways in which we've made it accessible for existing facilities, and why we have had dramatically more existing spaces go through our certification and our ratings than we have had new buildings, because you can choose a scorecard that basically allows you to focus on what matters most and what's within your reach. And so you can focus more on policies and programs, for instance, as opposed to major capital improvements where that's important. You can also get rewarded for the things that your building might already do.
We're getting close to time. Bob had a question about the transmission of COVID through HVAC systems. You want to clarify that, Bob, a little bit, like how long you have to worry about it in time, or how long you need to worry about it in space? What do you think?
I've seen research that maybe it doesn't, that there is nothing that confirms that it was based upon micron size of the virus, but that there is no evidence of room-to-room transmission through an HVAC.
I've seen mixed results on that, and I won't profess to be an expert on it, but I would say of all the things that you need to be focused on, it's kind of like cleaning. It's on the lower end of the list of things that are going to make the biggest difference. What's most important is getting ventilation in each of those spaces. I mean, filtration your options are really limited if you're dealing with an existing system, as you all well know. And so it falls into the category of like, it would be nice to do, but we can't always do it. And so, ventilation, even if it means opening up a window when it's cold, is just the number one thing to focus on right now. That, mask wearing, keeping people home when they're sick, the rest of it falls onto much more of in an emergency scenario like this, it's more of a nice to have than it is a must have, and I would put those things above hand sanitizer, for instance, for the same reasons. I think it's critically important for people to be washing their hands and, sanitizing when hand washing isn't available, but that we have so overemphasized the importance of these much more minor strategies than
Right.
we have, focused on the things that just make the most important, the most difference, which is what's coming out of our mouth and how much of it, what's coming out of our nose and how much of a chance is it going to reach the person sitting next to us. So physically distancing and, dealing with density, those are also, of course, related to the same set of strategies. But, we had an administration that was just like, applying all this pressure to all of these public health agencies to systematically remove that stuff from the guidance. I mean, they were literally redlining it out and ejecting it from the guidance, and that's just done us such a disservice. Also, the limited availability of PPE at the outset of the pandemic caused us to say, don't wear the good masks. Whatever you do, don't wear the good masks. Leave those for public health workers, or leave those for health workers and frontline workers. And and now those masks are available. And my staff will tell you, a couple of my staff will tell you, if they've had a family member in the hospital during COVID, I'm FedExing them KN95 masks. Like, do not send your mom to that hospital without a KN95 mask. And I wouldn't send my kid to school without a KN95 mask too. And I recognize that, it's a funding issue for districts to be able to provide that. But at minimum, I think that districts should be providing that kind of education. Impossible scenario, because then you provide the education, you can't provide the masks, and you're up against a wall. So I recognize these are complex scenarios you all are dealing with, but I regret so much that as a public health community, we discourage appropriate mask wearing, and saying that a cloth mask, which again was what the guidance was saying, as you know, early days, just wear a cloth face covering. That's like cheesecloth on your face. It's not going to do much work for you, So I'm all about, if there's one splurge that you're going to make as an individual, that's what you do. You order a case of these and you start giving them away to the people you care about the most.
That's what splurging looks like in our current day. Is
COVID splurge.
Well, I tell you, that's
What
a
a
lot more
world.
achievable than going and rebuilding all of our HVAC systems.
Absolutely.
Thank you.
Yeah. And the analogy that we've been kind of playing with in so much fun in the past few months or so has been, if COVID's a skunk, the first thing you want to do is keep the skunk out of the room. The second thing, if you can't do that, is get clean air in. And then at the very last measure, put on a bunch of masks. But kind of that makes a lot of sense. And I really appreciate the emphasis on, sort of the sick leave policy and the culture of not, thumping your chest, I'm going to work sick, look how tough and dedicated I am. It's like, no,
Right.
that's
Mhm.
it's actually counterproductive.
I can't even underscore that enough. And in our organization, we had a policy and sick leave, available, in ample amounts to our staff. And yet people still came in when they were sick because it was a cultural issue.
Yeah.
Because you are seen as rolling up your sleeves and caring about the business, showing up at work, hacking and wheezing all over your colleagues. So next week they were all out of the office.
Yeah.
And if there's one thing that we as organizations and businesses take away from this happens every year, right around cold and flu season. And so it's the same set of practices that are going to do us better. And that's why making these changes for the long term are worthwhile investments, and why we hope to be able to find some more support for you at the federal level, especially because it's a travesty that the federal government has neglected their role in adequate funding for school facilities for so long. And that's Mary's life mission. And it's a lot of the work that I've done in my career. And I think we feel like we really have a better chance this time around. So let's all keep our fingers crossed and stay tuned for more on what we need, where we need your help to really make the case for that.
Absolutely. And, to that effect, just, I guess maybe it's a good place to wrap. And yes, here, Vani says. So again, thank you so much for your time and expertise in
Hey, David, we're
Sure.
losing you a little bit.
Yeah, you're fading in and out.
Hey, Mary, do you want to
So
do
David-
the honors?
Yeah, I'm gonna
Somebody
wrap.
must be
I'm gonna wrap, folks. It's a little after 4.
You
and-
wrap.
and
Somebody's playing
thank you
Call of
so much.
Duty.
Yeah. Take care. All right, David.
Thanks,
Thank you.
everybody.
Thank you.
Thanks so much.
Thank you,
Yeah.
Rachel. Thank you, Angela.
Thank
Bye-bye.
you.
Bye-bye.
Thanks, everyone. Wonderful as always.